Hi, everybody, and welcome back to this week's episode of Rinkside. Emma, good to see you again. What's going on? How you been?
Good, good. Enjoying the summer so far. It always goes by so fast. And June is always gone in a blink of an eye. But
Yeah.
the humidity from last week has subsided a bit and just, yeah, enjoying
Mhm.
some cottage time. What about you?
Yeah. No, I've entered my other shade, which is either white or pink. I've been at ball diamonds relentlessly lately. Yeah, in the full summer mode, loving the summer sports out of a rink. It's really nice. I suppose you're enjoying the same, which is great. So this week, I'm really excited about this. First of all, it's an issue that I dealt with going through my athletic adventures, and that really is injury and dealing with injuries, overcoming injuries. It's a topic that I've certainly heard a lot about from our listeners who are really excited to have us talk about this. And as we usually do, bring in people much smarter than us. And so we managed to do that. And we're delighted to have Paul Colebrook joining us from the Orthopedic Center. Paul, thank you so much for joining us this week on Rinkside.
Yeah, pleasure to be here, guys.
Yeah, no one would know this. I was going to say for those who don't know, but that's not really doesn't make any sense. So Paul has actually been my physiotherapist for what, like a long time, like 15 years probably?
Yeah.
Yeah, it's been a long time. So you're at a different clinic when I first started working with you, but you've moved and it's such a nice facility. So we're really happy to have you on here to talk just about like kind of all things of like what you do and how injuries can also be prevented by kind of going to a physiotherapist and ahead of time. Like we want to talk about all those things. And I think that that's something that a lot of people don't even think about is that you can kind of pre-check things. So I kind of wanted to start there because with curling, we have to get assessments done to determine where there's like strengths and weaknesses and imbalances in our bodies. What do you do for that? Because you did mine initially. So can you explain a little bit about that process and like what you find there and how you can help athletes and what age you start? Like, can you just give us a full like rundown of what that would look like?
Yeah. So I guess it started quite a long time ago, probably 15 or 20 years ago. I started working with quite a few different national team athletes and traveling around the globe with them. And at that time, kind of injury prevention was definitely kind of a hot topic. And we were trying to come up with some strategies, especially with the canoe kayak athletes, where I was really embedded with them and traveling from Florida and training camps to World Cups to World Championships to try to prevent them so they were always in peak condition when it really mattered, which would be at the times they were competing. And so we came up with some screens or ways that we could look at people that were very specific to their sport. Obviously, a runner is different than a power lifter. A power lifter is different than a hockey player. And so we were going through very specific. And when we did your curling one, and then I designed one for Diving Canada. And essentially, you're trying to get a global picture of the person's strength profile, mobility profile, but also really importantly, their history of have they had any other injuries with the goal of thinking about them in a whole year plan in order to make sure that they didn't get sidetracked in their training. Because ultimately, when an athlete gets sidetracked in their training is when we see reduction in performance. So if you miss your off season because you're doing only rehab and you don't get any strength in, when the regular season comes, your body's not really ready for the loads, and we see those injuries recur and recur and recur. So it's super important to try to work with the coach hand in hand to make sure that the coach's program is being implemented so the athlete's body is ready to handle the loads that are coming its way. Yeah. And sometimes in some sports, like I worked with the 67s for a winter, like you have trauma, and trauma is sort of unpreventable in some situations. But a lot of the Olympic level athletes have less trauma, maybe other than some of the contact athletes. And so we manage them a little bit differently. But the same principle applies of ultimately preparation is the best tool to prevent injury.
Yeah, Paul, this is really fascinating because most people, when they hear of physiotherapy, and I have to disclaim, my wife's a registered physiotherapist as well, so she's going to be pretty upset that I didn't have her on, that we had you on. But most people don't think of physiotherapy in the sense of injury prevention. It's always an after the fact. Well, it can be an after the fact. By that I mean most high level elite athletes don't think of it always that way, right? I think of it in terms of youth athletes who are going to see physios to help them recover from an injury. So maybe you can tell us a little bit, maybe you can back up a little bit. You're one of the founders, I believe, right, of the Orthopedic Center.
Yeah, correct. Yeah.
It's just an amazing facility. Maybe you can tell us a little bit about that facility, because this idea of multidisciplinary healthcare team for athletes is astounding to me. I really wish I would have had access to something like that, either at the front end before injuries or after injuries. So maybe you can tell us a little bit about the approach you've taken over at the OOC, and how that plays into what Emma's describing in terms of getting ahead of things with preventing injury.
Yeah, so I guess as I'm practicing for a long time as I have, you learn that really having experts around you make you look a lot better than you really are. And so what I found was
Like
that
us today.
yeah, when I work closely with surgeons and I work closely with sport med docs and I work closely with coaches, it really made me a better physio. In other words, that I could point people in the right direction and help them a lot more instead of working in a silo. So with Auto Orthopedic Center, myself and a group of surgeons came together with the vision of trying to open up a center of excellence where we could move people along based on their appropriateness. So if we see a really arthritic hip, we can get it along. It's probably not going to respond to physio. We can move them along in the right path, or maybe a sports injury we can get in with our sports doctor quickly, and all work as a team together to try to help people in a very multidisciplinary center where we have physio, massage, we have podorthists, orthopedic surgeons, and also physicians who are physiatrists and sport medicine docs. So I think we have almost over 40 staff now. And so it's a really large team of people sort of all pulling in the same direction to help people get better, which is kind of nice. So less of a silo approach and much more of a team approach.
I can
Mhm.
say it was very helpful for me. It was, I think, a couple years ago, I ended up falling on the ice. Like, I just kind of turned weird and I hit my knee, and I was like, okay, it might just be inflamed. I'll give it a sec. And then I texted Paul. I was like, hey, what do I do? Like, I was like, I don't know what to do. It hurts so, like, I can barely sleep. He's like, hey, we'll come in. And I went in, and within that visit, the sports doctor happened to be available, but I was able to both get like a mildly treated on, but it was super inflamed, and see the sports doctor, get a referral for all the things, all in that same visit because it was there. So that was super helpful for me. It wasn't a big time frame where until I had to wait to get everything looked at. So that was really helpful. And I can say, like, having everything in one place was great for getting everything tackled quickly.
So, Paul, one of the questions that comes up a lot. I coach minor hockey and other sports. Is, what to do what to do when your child suffers an injury, because injuries at a young age, especially the more severe ones, can really be, you know, determinative in some ways of that child's experience or growth within their sport. If it's a bad enough injury, and most parents don't really know where to turn. And I think most of them don't think of physiotherapy. They think of going to their, local family doctor, and who knows what kind of referral happens from there. So what's your advice to these parents whose child maybe has a concussion, maybe has a shoulder tweak? What's your advice as a physiotherapist and someone, with your pedigree of the OOC, where they should go and how they should manage those sort of acute or more traumatic injuries that you've called them?
Yeah, good question. I'm like you, I'm a parent of kids who are all involved in soccer and high level hockey. And so I'm mixed in there as a dad as well as a physio. So I have a pretty good perspective on not just the national team athlete, but on the minor athlete side. And on the minor athlete side, I would find it really interesting because the volumes of training that some of these kids are doing is so high that we don't do a lot on the prevention side based on the volumes. And it's an interesting piece of get injured. It is really difficult because the athlete wants to return. And so I think the most important thing is being accurate in your diagnosis of the issue. And so a sports medicine center is usually a good place to start, like with a physio with experience, or a sports medicine, or even CHIO. And in Ottawa, we have the advent of CHIO here as well too, just to make sure you're getting an accurate picture of what is actually happening. And once you have an accurate picture of the underlying diagnosis, then you can plan. So some injuries, your kid can stay engaged in their sport. So I have a number of athletes right now who are staying engaged in their sport, and we're getting them better despite themselves. They're continuing to train, they're continuing to be with their team, and they're not really missing some of those key pieces. But then I also have had a lot of like ACL tear ruptures we've seen with alpine skiing and weirdly tag and a bunch of things for kids that I also treat that were on a totally different path. And that path requires multidisciplinary multidisciplinary, and even sometimes sports psychologists and teams. So we have some of those that we have access to. So it really comes down to how the severity of the injury, and
Mhm.
then how you manage it is really key. But ultimately, the goal for mine as a parent and also as a physio and also someone who's treated so much at high level is we want to keep them engaged in their sport if we can, and then be
Mhm.
decision makers together on the severity of the injury, and is it safe to continue, or is this, or do we need to take a small pause before you get back, and how can we train alternatively if you can't be on the ice or if you can't be on the soccer pitch, so that you get fulfilled that way as well too.
Is this a change over time that's been implemented in sport? Maybe more broadly, that rest was always the prescription, right? Just stay off of it. Whereas I hear now it's so much more about mobility, right? Stay engaged. So much seems to have changed in the prescription of how to treat and manage these injuries. So obviously, if it's a concussion, there's different considerations. But is mobility a big factor now, keeping people active throughout that injury recovery?
Yeah, I think ultimately there's two pieces of this. I also would work closely with coaches and coaching association when I teach coaches who are moving through their coaching levels on how to manage and prevent injury within their clubs and their environment where they're coaching. And ultimately there's a lot of evidence surrounding the psychosocial piece that comes with injury, which sometimes gets overlooked, especially for kids. And I think it's a big piece now where we really, and kind of on the more cutting edge stuff, where we don't want to be sort of on a rest only approach. We want to stay on an engagement approach. And sometimes you may prolong the recovery a little bit, but the benefits, the psychosocial benefits are better. And I think concussion research has showed us that we initially years ago rested all our concussion patients, dark rooms, glasses, no noise. And then the research has come out showing that we actually probably did more harm than good. And so now there's a much more sensible protocol that Hockey Canada and actually a physician from Ottawa, Mark Aubrey, put together. That's a very sensible back to ice within 5 to 6 days post concussion, but maintaining Rowan's law to make sure we wouldn't get a double crush. Yeah.
Yeah, that's everything always like changes. It's a constantly evolving knowledge. And I think that's something in your position you have to be on top of just to make sure that you're treating all your patients with the best methods that you can. What would you speak to? Because I mean, both Ryan and I are in this situation with assessments for like asymmetrical sports, like very highly asymmetrical sports. And the best way, like how you can help in that situation to prevent injury in that sense. Because I think that that's a common one where like with curling, it's like hips and knees because it's one side that takes all the load. And then in hockey, it's similar, but also like shoulder and all that. So how can you look like, yeah, how can you look into that early to kind of help prevent that?
Yeah, like I think like I don't know, I think I've thrown this term around a lot, is that like a tissue engineer, which is basically a fancy way of saying like all tissues in our body have capacity to take load, right? Like if you bend a popsicle stick, it's going to break. You can bend a popsicle stick and it'll deform, and you can bend a popsicle stick and it won't do anything. You can just put light pressure through it. But ultimately in sport, we're not trying to not make the popsicle stick thicker and stronger. We're having to put load through it. And we're always running close to that wire of injury in any sense, because we're trying to create micro trauma to make our body adapt so it gets bigger and stronger and faster. And then when you have someone who's asymmetrical. So if you have a canoeer, if you have a hockey player shoots left, if you have a curler, they all have these asymmetries within their sport. But if you let those asymmetries continue to build and build and build, you'll end up getting a situation where you create an abnormal tissue dynamic happening through the body. So you want to try to mitigate those, but understand you're kind of fighting an uphill battle. So it's okay to have some asymmetries, but you want to kind of be trying to deal with that throughout the year, because like bad technique and asymmetry is no problem at low volumes. But the moment you add high volume in, that's when the troubles come. So bad technique, asymmetry. So those athletes need to be more aware of their asymmetry. So I remember when I first started working with the canoe kayak team, the world champion, he would go to the dock after and paddle on the dock with like in the opposite side just to rebalance himself, this Hungarian
Mm.
guy. So, they had more sort of like old school coaching techniques of how to keep their athletes less injured. But essentially he was trying to spend some time kind of repatterning and offloading that side. And so every athlete in a asymmetrical sport usually needs to spend some time rebalancing, or they'll become so imbalanced it'll lead to something else, or maybe when they're cross training it'll lead to another injury.
One of the more when you say asymmetrical, I always think of Roger Federer's forearms.
Yeah, yeah,
That
yeah,
was,
yeah.
yeah. His right forearm was like Popeye.
Yeah. Yeah, exactly. Yeah, and you're not gonna take away asymmetries in asymmetrical sports. It's more about
Yeah,
managing. Yeah, yeah,
managing.
exactly.
Yeah.
Yeah. Yeah. And that's a really key. And that's part of that responsibility. And this is of that athlete as they get higher level and as their volumes go up and they want to get to that next level, that they have to start having that what we used to call prehab, that preventative rehab piece in their program to do it. And really, like I'm getting so old, there weren't even strength and conditioning coaches when I was around when I first started with national team programs. And now a lot of national team programs have a strength and conditioning coach and they're kind of incorporating a lot of that stuff and forcing the athletes to do it, which is great because implementation was really hard.
So one of the things you said earlier, Paul, about volume is getting high for young athletes, and this is something that we've talked about on our show. And I couldn't agree more. The expectations on young athletes now is way different than it was even 10, 20, certainly 30 years ago. What are you seeing in your profession as a consequence of that high volume and really no rest? Like some of these kids are into highly repetitive movements, mentally and physically. Are you seeing any trends in your profession, certainly at the OOC, of what injuries are coming in, how kids are coping?
Yeah, like I think like I'm part of that whole circle for sure
Yeah.
because I'm in the hockey rinks. My son plays high level hockey. He's you going his U16 year, so I'm fully baked into all of this stuff. And my
Yeah.
daughter plays competitive soccer, and then I'm a physio as well too. So
Yeah.
so I see all of it, and you forget that they're kids, and when they
Yeah.
go home, they don't want to do the like they're not like Emma
Yeah.
Miskew. Who
Yeah.
know like it's
Yeah.
like a job and they're professionals. They're at a whole other level of maturity and it's hard. And then in addition to that, there's also cultural. In other words, like if you go to a hockey rink, it's very difficult to find a space for a kid to stretch. It's very difficult so it's really so they when they come home, they have to try to find it to do it. And I am not perfect. My son is not the best at stretching. Like we're not perfect either, but for sure
Yeah.
the volumes that kids are doing to reach these elite levels is getting higher. We're seeing a really increased incidence in hip pathology and labral injury in people's hips. My son may be one of those
Mm.
people that we see. Soccer players, girls particularly, we're seeing an increased incidence in ACLs. They're trying their best to prevent ACL injuries, but it's hard in certain sports like alpine skiing and
Mhm.
soccer. So there's been changes and they do have some prevention protocols out there, but it's just very difficult. Like I tried to implement an ACL prevention protocol for a whole bunch of alpine clubs in the Outaouais, basically the Ottawa region.
Mhm.
And, just understanding, like I used to ski race, like getting your ski stuff up and heading outside and then doing a dynamic warm up. Like it just has a hard time translating. And so
Yeah.
it gets abandoned. So there's got to be sort of like, if we continue to train our kids at these volumes, there will need to be some cultural shift change. My only sales pitch that I tell everybody is that it's actually performance enhancing. So we always think about prevent injury. Well, the reality is that it's true, it does that. But really, if you get stronger and more balanced, you actually perform better. And I think that's a better way to frame it. And it hasn't totally worked its way through the system yet, but it's starting. But I think it's going to be actually the coaches who lead it more than physios in the community. But that stuff has started to come down. But it's just some environments, like new rinks are built and there's still no space for kids to do any cool down, warm up, or
Okay.
anything like that. It's a very interesting dynamic. Yeah.
There's actually signs that say no team warm-ups. I know
Yeah,
it's
exactly. Exactly.
the
Yeah.
exact
Yeah.
opposite. Yeah, because one of the as you talk here, I think about it's almost like athletes need these. I've done them at the higher levels, but why not kids? Like these screenings, right? Preseason
Sure.
screenings. Let's bring all these athletes to you. That's a little plug for OC here, and you can tell them what all their weaknesses, how they're predisposed. What they need to work on in season. Most people think of the off-season workout, but not the in-season. And so, is that something that you have ever done or do for
Yeah,
you
so we've
more
done
youth
that
athletes?
so we did it for, actually, this is an interesting case. So a canoe club in Ottawa, the Rio Canoe Club had us come out a number of years ago and do screen all their athletes. And it was really interesting doing
Uh-huh.
it because I've been doing Team Canada screening for a decade. And the
Yeah.
canoe kayak kids at Canoe Rio had exactly the opposite attributes of the national team athletes. So it was a very interesting thing to do. So, and I think maybe the guys who rose, sort of like the guys who became Olympians and the guys sort of naturally had some of that stuff in them because there is a genetic genetic component to sports that no one likes to talk about too much publicly, but some kids just are stronger and have more capacity. Some kids are more flexible and have more flexibility. But yeah, so we've done that quite a bit with a number of different clubs and a number of different sports, from diving to canoe kayak to running to a bunch of different things. Yeah. But it's a
Yeah.
culture. Yeah. Go ahead.
Oh, no, I was just going to say like that. I think that's something that is so important because not only are a lot of strength programs for young age groups just blanketed, everyone's going to do this exact program. We're all going to do it. And what is not talked about is that everybody's built differently and have different strengths, different weaknesses. So not having this blanket program, while just general strength is good, knowing what one person could work on to prevent injury on their end could be something totally different than another player on the team who maybe they could look like they're the same build. That doesn't really change anything when it comes to what you see in these assessments. So can you talk like a little bit about the assessment? Because I think people are curious, like you're not going in and lifting weight. You're doing small movements to, like, at least with me. So it's like small movements to determine where those muscle groups are. Can you talk like a little bit about that? Because it's been a while since I've done one with you. I don't know if yours has changed, but that's how it was when I was there.
Yeah. So I think when different sports will have different like a different scan of what we do, with some similarities and some differences. But ultimately what you're trying to do is determine, like, do the joints that need to move through certain ranges of motion have the range of motions required? So if I can't move through my ankle, then I got to move through my knee and my hip. If I can't move through my hip, then I got to move through my knee and my ankle. So you're trying to get an idea of where their movement patterns are in order for them to be able to move appropriately and with better technique. The second thing we're looking at is, what's their core strength profile look like? What do they look like centrally? Can they control load? Do they collapse? Do they have strength or movement patterns, as we sort of go in from there? So you can, when you're done, you sort of get a collection of essentially measurements that will lead you down a path based on that athlete. So if you have let's take a curler, for example. If you don't have the ability to bend in your ankle, then you got to pick up that motion somewhere else, to get down to that hack. If you don't have that range of motion in your hip joint, then your knee's going to have to flare out. So it comes down to a number of different things. For a hockey player, if they don't have adequate dorsiflexion in their ankle, they're going to have a hard time getting knees over toes and proper edge control. So there's lots of different things that we look at, and each sport's a little bit differently. Like divers were very different for the national diving team. Like how their shoulder blades moved was super important to protect their shoulders. If they don't have unbelievably flexible shoulder girdles, then they're not going to be able to get their arms and shoulder blades and everything on a line when they hit the water, because the water is, although they make it look really soft when they go in, it is not soft. It's pretty amazing what they do with the dynamics. But so every sport's a little bit different, but yeah, we're trying to look at specifically certain joints and certain strength profiles that we want to see in those sports. And if we don't see them, then we want to remediate it or try to fix it.
Paul, maybe this is a bit niche, but one of the things that I'm watching as a hockey player that went through hockey, where contact was introduced at a younger age than it is now. So maybe it's your son you described as being at U16.
Yeah.
Probably would have gone through the contact starting at U14.
Yeah. So he's been 2 years of contact now.
2 years of it. So before that, right? When maybe if you were growing up playing hockey, certainly when I was, it was 2 years younger than that. And so anecdotally anyways, what I'm seeing around rinks is there's far more injuries occurring now that contact has been introduced later, as the athletes are bigger, stronger, faster. So as they're trying to learn something that could be quite dangerous, the implications are more severe. Am I making that up, or are you seeing that? Are you seeing players come to you at U14 a lot? Are you able
Yeah.
to isolate when you're seeing athletes come in because of contact-related injuries in hockey?
Yeah, so we see, I would say, like, just because I'm around the rinks at the AAA level in Ottawa, I would say
Yeah.
every team has a fracture from contact on every level,
Right.
from like U14, U15, and U16. If you took a snapshot of it at any point in time, probably one player on that team would be out with some fracture, like wrist, collarbone, or whatever, from contact hockey, which is part of the game. To
Yeah.
kind of go back to your point, just because I've been
Yeah.
part of these conversations, like when it was introduced younger, the
Yeah.
velocities are lower and nobody's gone through puberty yet. So there is technique to getting hit. There's
That's right.
technique to absorbing hits. There is a technique to protect yourself. And so I think the concept is if we start introducing it younger, that the kids will have this technique. So when they start getting bigger and the velocities really increase, that they can do it. The other piece is that kids are trained like 10 times more than they ever were, and they're going much
Sure.
faster and they're much bigger than they ever were. And so
exactly.
it's the velocities are a lot higher, and and no major change has happened to clavicle strength in the human body in the same amount of time
You
as
haven't figured that out yet? Yeah.
as skating coaches in Ottawa. So you're getting, there's been no bony change, but there's been a lot of acceleration changes and training that hockey players are becoming better. And that's across the board, probably for most contact sports. So yeah, it's a question that I think will go on.
Yeah.
I don't know what the answer is.
Mm-hmm.
Yeah, I think Hockey Canada will probably do it, but for sure we see that at all times. But when I was treating the 67s, they were getting injured too. They were breaking things. I think just contact sports and velocities are hard. Yeah.
Is there any way to prevent all those breakages and fractures in contact sports? Like, is like strengthening is just kind of like getting as strong as you can the only option, or is there mobility stuff and, like you said, like absorbing hits and there's technique to that? Like, is there a way to prepare or prevent, or is it kind of just the way that it is?
Yeah, like I think it's a good question. And I think that like Ryan may be better at this because he played way higher level than I did. But you get the players who never get injured, you get the players who get injured all the time. Sometimes there's a skill base to that. The guys who can see the ice, their head is up, they're looking around, they're aware of the situation. Other players are less situationally aware. We still seeing a lot of kids with growth plates with little bones but strong legs and accelerating. And you see big size discrepancies. Like, we can have, a kid out there who's 6'1", and you could have a kid out there who's 5'1". So you can get these big size differentials at these ages. And so you have like, once again, that tissue engineer too much force too quickly and things break, right? So, but yeah, I don't think we'll ever take it out of hockey. I think it's more a matter of like skill, head up stuff is important as they sort of come through. Yeah.
I never understood that concept, Paul, that you've hit there. Some players just seem to get injured and some didn't. I don't know what it was. And some more were susceptible to concussions than others, right?
Yeah. Yeah.
Which is probably a whole science, which you understand. But
Yeah. Yeah. Well, they say that like if you're doing a screen on someone, the biggest predictor of injury is previous injury. So if you want to predict what the person's going to have, ask them what they had last year and they'll probably have that again or whatever. But in contact sports, there's definitely some situationals to it. And yeah, everybody's just like some people's body, they can take load, and other bodies have more flexibility, and their body doesn't do as well with really heavy loads coming onto it. They're just genetically different.
You can't, I guess, well, it's public now because you're on record and we'll hold you to it. But as you welcome athletes into the OOC, and particularly young athletes, are there sports that you really just love working with over others?
Yeah. You know what? I still really enjoy treating athletes. That's been a big part of my practice.
Yeah.
I ski raced for a while in university, and so I have a passion for skiing. So I see lots of skiers. I spend a ton of time with canoe kayak athletes. I love those guys as well too. And hockey, I talk a lot of hockey. Hockey sort of consumes, and of course any curlers we see, but we don't see too many curlers at the young age. But yeah, I would say hockey players, and I see a lot of canoe kayak athletes and skiers would probably be my big three, and soccer. Yeah.
Yeah.
I don't know if you have a life.
And Emma was a nice soccer player too. Emma was a multi-athlete too here with soccer.
Yeah, you need a life-size Emma Miskew signed photo inside the.
There's a few photos in there.
I mean, I don't want to. I mean, Emma's pretty accomplished. There's not, like staying power, and like what their team did this year was pretty monumental. And knowing them for as long as I've known them all, unfortunately, some of them have gone to Edmonton, so I don't get to touch as much as I did. But it's really, really special what they've done in sport for so long, and it's pretty spectacular.
So, one other question that we've talked about this on previous podcasts, and so I'm interested to hear your perspective from your physio side of it. Multi-sport athletes versus one sport, one dedicated sport. Do you notice that more injuries come from someone who's focused on just one sport because you're repeating that same movement maybe more than you're supposed to, versus someone who is playing other sports a little bit more well-rounded at a young age might help balance that? Or is that not really something you see?
Yeah, I would say like for the issue that I fall into as a parent, and if your kid wants to be elite, there is a volume of training that they need to get in to be at that elite level. So if I look at the training, because I've traveled around with so many different national teams, they all train the same. It's 4 to 5 hours a day. There's no difference between any national team program, and same with hockey. They package it slightly differently, but it still works out to that volume of training. And for kids to be picked to go to the next level, every sport has a different maturation date. Oh, like if I'm a diver, I need to be like pretty big by the time I'm 13 or 14 years old. Like I need to show that I'm at an elite level at 13 or 14. If I'm a hockey player, like I'm in grade 10 and we're hurting the crowd pretty significantly in grade 10. So you get caught with these dates for kids to advance to the next level of athleticism where they have to have those volume of hours or they're just not going to be good enough. So the multi-sport always starts to take a back seat for this pressure to be picked out at the times when you need to be picked out. So Olympic, but ultimately we know that multi-sport is good. We know it's better for performance because you learn more motor patterns. We know it's better for injury, but it's really hard as a parent to get them into those environments. So the answer to your question is yes, multi-sport is better, but it's really hard so for them to get that other experience when they're training and kind of trying to get to that next level. Yeah.
Yeah, I suppose the multi-sport aspect is really foundational, right? The more sports and coordination and skills that younger
Exactly.
children can learn, and they build on that, and then they start to narrow down.
Yeah, that hyper specialization. Yeah. But there's a lot of good evidence on that showing that if you don't have that, then when time for them to progress, that they don't have what we call motor patterns. They don't have those additional motor patterns to progress because they've been too linear. And maybe that's why we're seeing also joints being shaped certain directions and leading to early tears in hip joints and stuff like that for labrums and stuff like that. So that's part of the theory of these widespread cam deformities in hockey players and stuff like that.
Well, this is pretty fascinating, Paul. You're going to be quickly one of our go-to expert guests that people love to
Yeah.
hear from. Seriously, it's been great. We should let you go back to treating people who desperately need you. But I do mean it. This topic in particular, and you as a guest, has been really enlightening, and can't thank you enough for being on Rinkside today.
Yeah, well, really nice to meet you, Ryan, and Emma. Great to always connect with you. It's been super pleasurable. So yeah, have me on anytime, guys.